Health outcomes. Changes due to interventions. To bring positive change, patient experiences and health must both improve. Healthcare costs must be lowered, and clinician and staff burnout has to end. But our problems are big. 133 million Americans have at least one chronic disease. 500,000 people are dying every year from hospital errors, injuries, and infection. The shortage of primary care professionals will be as much as 100,000 in just the next 5 years. Big problems require bigger solutions. Positive change needs acceleration. It needs to happen now. But these are not so easy solutions that many don't want to hear, and even few are willing to talk about. How to lead such a change? How to discover, discuss, and disrupt healthcare to make a difference now? This is VITALS, Visionary Health Leadership in Action.
Well, welcome to VITALS. I'm really pleased to be able to welcome all of you for the first time for VITALS on campus, as we are able to do a virtual meetup this time, both here at our lovely campus in Northeast Ohio Medical University, as well as online through the capabilities of Zoom, so we can reach an even broader audience. I'm really pleased to be able to do this today with a really special guest. As you know, VITALS is an opportunity for leaders to come together and share how we're trying to transform the US healthcare system. Arguably the best in the world at delivery, but also arguably not maintained and well run as it could be, as it's taking up a huge amount of the financial resources within our country. And we are still delivering suboptimal care to certain populations within the United States. VITALS uses the tools of value, innovation, technology, advocacy, leadership, and service. And we bring on leaders within the US to discuss how they're using these tools to transform healthcare today at their institutions within their regions. I'm really pleased that our speaker today is Dr. Donald Malone. Dr. Malone is the president of the Cleveland Clinic, Ohio Hospitals and Family Health Centers. Dr. Malone previously had been the president of Cleveland Clinic's Lutheran Hospital, and he had also been the chairman of psychiatry and psychology for the Cleveland Clinic. He's been a leader in psychiatric research focused on anxiety disorders, substance abuse around steroid use and abuse, as well as a leader in deep brain stimulation. He continues to be an outstanding researcher, clinician, and now one of the top leaders in the state of Ohio at the #2, though many of us would argue #1 health system in the world, the Cleveland Clinic. Very importantly, Dr. Malone is a transformational healthcare leader who graduated from Northeast Ohio Medical University in the class of 1985, where he was designated an AOA graduate, putting him in the top 15% of all graduates coming out of this university. Without further ado, I ask you to please welcome to the stage Dr. Donald Malone.
Thanks, John. I really appreciate it. Everybody hear me okay? We are live without masks. It's really a pleasure to be here, without a doubt. Thank you so much for the invitation. It's great to be back on campus, although it looks absolutely nothing like it looked when I arrived here in 1981. We just had one auditorium, Olson Auditorium, and Dr. Sperling and I were in that class, and he used to sit up front and I used to sit in the back, but we won't get into that. I'm also really excited at the name on the auditorium. I'm sure that most of you do not know who Dr. Watana Kunikorn was. He was an infectious disease doc in Youngstown, and I published my first paper with him. It was in the Green Journal, the American Journal of Internal Medicine, and Chacha was the senior author, and he let me be first author. And that started my research career. He was an incredible mentor. And so those are the folks that are here at NEOMED that make a difference over the long term. Serpil Erzurum, who is the head of the Learner Research Institute at the Cleveland Clinic, also learned from Dr. Watana Kunikorn. He was her mentor, and she's one of the best researchers in the world. So what I'd like to do today, I debated about what to talk about, but I think what I landed on was leadership. We desperately need physician leaders. This is a hard time in medicine. Nobody's going to tell you differently. And it is going to require deft leadership to really go the extra mile and to make a difference over the long term. We need physicians to lead. Clinicians of all kinds, and that's not to say there aren't other good leaders in medicine, or that you can't come from different stripes and different backgrounds, but there's something about being a clinician. There's something about being a physician. And so what I'd like to do is tell you a little bit about my journey into leadership, which I call the accidental leader, because it really was an accident. I had no idea that I was going to be a leader of any kind in any shape or form. But it happened. And I hope this story encourages some of you to really look at that as you go into your own careers, that it's so desperately needed. We need you. So with that, I will talk a little bit about, a lot of this will be personal, about my journey. And it starts really with going into medicine. I had no idea what I wanted to go into. I like science, I like people. And at that time, there was this new medical school, a 6-year school starting in Ohio. And I thought, I should probably apply to that. So I applied to Youngstown, Akron, and Kent, and didn't even get interviews at Akron and Kent. I wasn't the world's greatest high school student. But I did get on the wait list at Youngstown, and I got in. And that was really the start of my journey. It could have gone in very different ways. And so accidental in some ways is true. And it's really worked out because I loved medicine. And when I got to medical school, I didn't know what I wanted to go into either. I figured, maybe I'll be a neurosurgeon. That'll be kind of cool. I like neuroscience. And then I hit psychiatry and I said, that's it for me. And it has been. And with that, I did my training, I did research. I grew my career in research, but along the way, I started to see a need for physicians to be involved in different ways in leadership. This started on a number of different committees. It grew into other chairing committees and doing other leadership assignments. And it just kind of blossomed from there. So it really was just, I didn't have a direction, but it worked out for me. I'll talk about committee, organizations, leadership in general. But I do need to talk about the Cleveland Clinic because the clinic I've been there it'll be 33 years in July. It's hard to believe. Came right out of training. I'm from the Cleveland area. The Cleveland Clinic offered some real benefits and some disadvantages. It's huge. It's very big. And that offers opportunity for a wide spectrum of potential involvement. It also offers some disadvantages. Some of the benefits of size, you learn from effective and ineffective leaders. You're able to watch people do different things in different positions and learn from that. And I did, and I'll talk a little bit about that. And also the clinic intentionally develops physician leaders. Better now than probably 30 years ago, but we very intentionally go in and we look for folks that have leadership potential, and we try to develop that, whether it's through formal education, mentoring, or putting them into different positions. There's opportunities were everywhere at the clinic, and one of the things I learned was to say yes. You will be asked to do something wherever you end up as a resident or certainly as a faculty member. You'll be asked to, can you help with this? And you're going to say, I don't really want to do that. That's the thing you probably should do because you learn from that and you grow from that. And there are things that I said yes to that I had no real desire to do, but they were some of my best growing experiences. And at the clinic, you learn to build bridges across different departments, institutes, It really requires that. Otherwise, you're not successful. The disadvantages, there's a lot of competitors for different positions. I mean, there are 5 people at least who could step into my position right now at the Cleveland Clinic and wouldn't miss a beat. 3 of them probably do a much better job than I do, but don't tell them that. Power struggles are common. People want to climb the ladder. It's part of the job. And you can get pigeonholed. You can get put into a certain position and stay there for years and years and years and not get noticed. So there are some disadvantages, but overall, for me, it was highly advantageous. Just a couple of things. As you grow in your leadership, one of the things you need to do is learn from others. You need to carefully watch other leaders because they do some things that are amazingly effective and they do some things that aren't effective at all. And you have to take from both of those. So I've had a few leaders, and I'll talk a little bit more about this in a minute. One of the first was a gentleman named Frank Moscarillo, and he was the executive director of this national organization that I'll talk about in a minute. And he identified about 20 years ago, he said to me, you know, you could really be effective in this organization. And I'm thinking, no way. And he's the one that planted that seed. And if I had just said to him, no, I'm not interested, I don't know that any of this would have happened. Mike Modick was the first head of the Neurological Institute. And I'll talk in a minute. He's the one that said to me, we need to grow behavioral health. We have to make this happen. It's a small little thing on main campus. This has to grow, and you're the one to do it. Again, I said, I can't do that. But I didn't. I said, okay, I didn't know. And again, that kind of saying yes made a difference. Toby Cosgrove, the former CEO of the clinic, one of the things I learned from him, think big. Cleveland Clinic is now in Abu Dhabi. Just opened, I was in London last week opening our hospital in London. We have a place in Nevada and in Las Vegas. We're in Toronto. We have consulting gigs in other parts of the world. None of that would have been the case without Toby. And yes, sometimes you do things that maybe in retrospect you go, I wish I wouldn't have done that one. But his vision, his looking at the big picture, I learned a lot from that. And actually, the last one is Jan Murphy, who I understand was here this morning. Jan is a president. She's a CEO of Mercy up in St. Vincent's up in Cleveland, and works with the Sisters of Charity. And from her, I really learned honesty and integrity was so crucial, that your reputation, how other people view you, is key to how successful you can be. So just a couple of leadership challenges that I'll go through that hopefully will give you some idea of how I learned as I went along. The first was the organization. So it was the Associated in Convulsive Therapy. I did ACT back in the day, and there was an American organization of people that performed DCT. And at that time, we were starting new research in neuromodulation, whether it be magnetic stimulation, whether it be deep brain stimulation, which was my field, a lot of neuroimaging research. And so you had the old guard that was a member of this organization for a long time, and some of the younger, newer guard that were interested in all kinds of different new research. And I started, Frank was the one that told me, you can grow in this organization. I want you to be on track to be president. And I thought, come on. So 6 years later, I was president for 2 years. And it was the exact moment in time where this conflict came to a head. And they were going to split off into 2 organizations. And I said, this is silly. Why would we do this? Let's figure this out. We can do this. And it became an international organization, the International Society of ECT and Neuromodulation. And the 2 sides came together. It took 2 years, all of 2 years. But people did it, and they got together. And what I realized is I was credible, I was honest, I was transparent. We came together, we talked openly about the differences and the difficulties, and it worked. And from that, I really learned quite a bit about how you can effectively drive folks to decisions. The second one was when I talked about the head of the the Neuro Institute, Mike Modick, said, regionalize behavioral health. So we had 30 PhD and MD faculty at the time. We now have roughly 130 PhD and MD faculty. We went from small units on main campus. We now have 285 beds spread over 5 hospitals. We're over 20 outpatient sites during that course of time. I got everybody together in the beginning and said, this is the goal. This is what we need to do. And there were 50 different agendas in the room, at least, including mine. And it took a while. But what was important about that is they knew ultimately I had the vote. I was tasked with doing this. It was up to me to make sure this happened and I could make decisions. Everyone got a voice. Not everybody got a vote. We minimized the closed door discussions. We kept it in the room. And we made some hard decisions. We closed units at certain hospitals. We opened them in others. We put some groups, minimized their importance. Other groups we maximized. And it was a very difficult thing, but ultimately it worked. And ultimately people got on board. They understood the vision. They understood what we had to do. So it was another great learning experience of how to do that. So I was chair of this committee, still am. I can't get rid of it. It's called the Space Committee at the Cleveland Clinic. Now, if you're at the Cleveland Clinic, if you're anywhere now, the most important thing in the world is you have space. So your department has to have space. You have to have an office. You have to have this. You have to have lab space. Well, I was in charge of that. Nobody wanted that job. That was the job I said before that you'd say, you got to be kidding me. And you take it anyway. I did. I think I learned the most from that job because I learned that hard conversations were incredibly productive. If there were 2 people fighting over the same space, the 3 of us got together and let's figure this out. And I learned, I used to avoid hard conversations because they're not fun, right? I mean, nobody wants to have a difficult conversation. But I found that that was the most effective way to get things to work. There's a lot of power struggles. I learned that a lot of them aren't worth it. Some are, some you have to get into, but for the most part, you move on and minimize them. And the last thing that I think was so instructive for me that told me I was sort of on the right path, at Lutheran Hospital, about a quarter of our employees are union. And we had a union contract come due it's been about 3 years ago now. And it was a very difficult negotiation, to say the least. And what we offered was actually incredibly fair. I had developed very close relationships with the employees at Lutheran. And a lot of our employees are housekeeping, kitchen staff, facilities, some nursing assistants, things like that. They knew me, I knew them. And we made our final contract offer. The union refused it, or the union leadership refused it, but we forced a vote. And I was confident that that relationship I had with those folks, they knew I was fair and that I was reasonable. And that relationship, I took a chance. I had a calculated risk that was going to carry the day, and it did. And it taught me that the power of those relationships as a leader is crucial to your success. Just a few other things before we get into question and answers. Knowledge and experience, there's no substitute. We have people come in now and, a year out of med school, they'll get an MBA and they'll do their residency and show up and say, I want a leadership position. I get it, but there's a road, and I could not have done anything like I do now, even 10 years ago, let alone 20 years ago, certainly not 30 years ago. And it's those experiences that carry the day. And they also provide you with credibility among the folks that you're leading and the folks that you're working with in your teams. Dealing with frustration. I wasn't as good at dealing with frustration back a number of years ago as I am today. It's probably just being beat over the head over and over and over and over again that you kind of get used to it. But it's important that when you get frustrated, when you get irritated, when you feel, golly, this is really hard, that you not dump it on your team. And that goes for when you're making rounds in the hospital, right? You're the physician leader on a team. And you want, things aren't going as well with a patient as you'd like them to go. Dispersing all that frustration and anger and irritation onto everybody else doesn't help. It doesn't drive the right outcome, which is that patient getting better. And so as a leader, you have to deal with that. You have to keep it sometimes. I'm not saying you don't tell people you're frustrated sometimes, but it's important. And hard conversations. Again, firing somebody is not the easiest thing in the world to do, I can promise you. Demoting somebody from a position into another position. Telling somebody they didn't get this job, that somebody else got it. Working these space things out. None of that's fun. But I really actually learned to embrace it. And the faster you have those difficult conversations, the more effective of a leader you are. Why was I successful? A lot of it was good fortune, I think. I was in the right place at the right time. And I think one of the most important things is don't get too impressed with yourself. If you're not too impressed with yourself, other people will engage with you. If you are, it distances. And that distance is not always, it's not an effective strategy. You want your team on board. You want them together with you. You want them on your team and engaged. And to me, some of the most important things, being calm, honest, and transparent, having integrity. Warren Buffett had a great quote one time. Somebody asked him, they said, when you look for leaders in your company, what do you look for? He says, in intelligence, energy, and integrity. And if you don't have integrity, I hope you don't have the other two. He said, if you don't have integrity, I want you to be dumb and lazy because you won't do any harm. And it's really a fascinating quote, but it's absolutely true. Delegate. You got to let people, in my job, I may have 52,000 employees. I can't lead everything. There's no way. Delegation is crucial. And when you delegate, you have to trust. Pick the right people, trust them to do the right things, and most importantly, give them credit when they do them. I've never, ever regretted going over the top and giving people credit. They'll run through a wall for you. And that is, to me, that's really important. And encourage dissent in the room. And that translates into medical care too. I mean, if you're running a code and someone on your team notices that you're not doing the right thing, or you have the wrong catheter, or you're putting it in the wrong place, or you're doing the wrong thing, or you're in your OR and it's a wrong site, or you didn't make a sponge count, you want that person to speak up. You want that person to say, doctor, stop the line. If you don't have that, you have problems. And so you want that as a leader too. You want that on your team. You want someone on your team to say, I don't agree with that. Let's talk about why. That gets you the best decisions. And when you come to a decision, you certainly want unity when the door opens. I'll end on a quote that I actually think about every morning when I get up. I told you I've been lucky. I'm very fortunate. I have a really nice, I love the job that I do. I love going to work every day. But I think about Bill Gates' quote every day. Success is a lousy teacher. It seduces smart people into thinking they can't lose. And so every day you have to continue to think and do. And as a physician, you do the same thing, right? You have to continue to learn, you have to continue to grow, you have to continue to learn more to take better care of your patients. And you can't be satisfied because it doesn't always work when you keep doing it the way you've always done it. You have to develop, you have to grow, and you have to just mature in whatever position you're in. So I'm going to end here. We got the 17 minutes. I'm going to be a minute over, but not bad. And then we'll have some questions and answers. I hope that you ask questions, and I'll try to do the best I can to answer them. They don't have to be about leadership. They can be about anything in medicine. I will try my best to answer them. And with that, I want to encourage, especially the students here, as you go on in your careers, think about leadership. If you have those skills, say yes, get into different things, begin to grow as a leader. The field desperately needs you. Healthcare desperately needs you. So with that, I will end. I will invite Betty Lynn Fisher up from the Akron Beacon Journal. And please ask questions, because if a journalist starts to ask me questions, I'm in trouble. Then I don't know how I'll get there, but thank you.
Am I on? Can you hear me? All right. Okay, hold on. I got to put a couple things down. Thanks, Dr. Malone. Okay, so we've got a great crowd here, and then I saw about 60 people online as well. So I'm going to do a little air traffic controlling and try to do this both. So what I'd like to encourage all of you is, in person here, we've got 4 tables, and there are mics right there, and they're live. So if you have a question, walk up to one, and then I'll try to direct when we're ready, and I'll try to do, we've already got some questions here online as well. Thank you for having me here. I am a fill-in here for Monica Robbins with WKYC, who is the normal moderator. And I just messaged with her today. She is back at work after her second brain surgery. And her message today was, well, the doctor told me I maybe should be slowing down a little bit. And that's not really my speed. So Monica is doing well and probably working too hard. So let's start with something online here. Actually, I see somebody up there. Go ahead, Dr. Lee.
Hi, Betty. Good
Hi.
to see you. So sometimes women have special challenges on becoming leaders. So I was just wondering if you could offer some advice for women, especially some of the young women here, aspiring physicians who would like to become a leader in their future health system.
That's a great question. So the question, if everybody heard it, was, what about women in leadership? What are some of the advice? There have been far more challenges for women over the years getting into leadership positions. There's no question. That's just reality. It's been that way. I do think it's a better day. I think we're paying more attention, mostly because we realize that women make incredible leaders. But what else we've learned is we have to be intentional. It has to start. And I've had conversations with some of our young female physicians about, you really have skills. You have a lot of potential to be a chairman, or to do this, or to lead this. And often it's surprise back. Really? Really? And that's when it makes a difference. I think without it being intentional, things keep going on the way they are, and that's not okay. So I think that, even the Cleveland Clinic now has its first female chief of staff in history. Barry Ridgway is an incredible leader. And it's so exciting. And there's 3 of us, one who runs the hospitals in Ohio, and one who's chief of staff, and one who's the head of research and education. That's Circle. So 2 of the 3 are female. And that was not the case before. I think that's a start. And the other thing that I think is so important is to start early and grow early, because you know, one of the mistakes sometimes we make is we pluck somebody who's not quite ready and put them into a leadership position, and then they fail. And that's the worst thing that we can do. And whether that's gender, racial, you know, we want to be diverse, but we have to make sure people are prepared to be able to have these kind of positions. So absolutely, I think, again, I can't encourage people enough to do that. And I think it's happening a lot slower than it ever should have, but I think it is happening. Thanks for the question.
Can we go to the one in the back over on this side?
Yeah, thank you, Dr. Malone. Excellent presentation. And I took notes while you were talking. One of the comments I would like to follow up on is your comment about encouraging dissent. When I was younger, I would be quite shy, but over the years, I've opened up and asked questions, including dissenting questions. But at times I've gotten negative feedback when I have. And I wonder how you've handled that when you may have gotten some negative feedback within, you know, decisions you made that have not been popular, or how to address that if you have a dissenting opinion that's not well received. Thank you.
That's a great question. So if I do have a dissenting opinion, or somebody has a dissenting opinion of me, how does that get handled? And I think in the past, what I've done, because there have been times where I've been shut down in a meeting or something else, I would always go back individually with the leader afterwards and say, just want to make sure you understood what I was trying to say. But that's not a good leader that shuts that down. I mean, there's a time and a place that say, look, this is the decision, this is what we're going to do. But actually squashing input is the worst thing a leader can do. It's the absolute worst thing. And so, you know, when I have a new group, for example, one of the first things I do is say, I just want you to understand, and a lot of people say this, I want to hear what you think. And then I say, I really, really want to hear what you think. Because if I don't, I can't read your mind. I don't know. And we'll make a better decision if you all provide input. Thanks.
Back there.
Hello, my name is Lauren. I'm a third-year pharmacy student. I was just wondering, in your position, in what ways do you promote interprofessional diversity in different leadership committees at the Cleveland Clinic? So the question is diversity of backgrounds in leadership positions as far as pharmacy, nursing. Good, okay. We have leaders of all kinds, and I'll give you a story from Lutheran Hospital that hopefully will speak to this. We had a housekeeper who was there during the day, Alvin. I don't think Alvin's watching today, but if you are, he was awesome. He would talk to the patients as he went into their rooms. He was comfortable in nursing stations. He did his job incredibly well. And we were looking for a second shift supervisor. And I said, Alvin. He says, Dr. Malone, I can't lead. I don't know how to do this. I said, we need you. You know them. You know everybody. You know their job. You're a great example of how to do it. And nobody else is going to be able to walk in and have the credibility that you have. And he did it, and he was awesome. That applies to every stripe. The head of pharmacy, Sam Calabrese, reports up, and Sam is just an unbelievable leader. He's an incredible leader. Nobody who isn't a pharmacist can do what Sam does. They won't have the credibility, and frankly, won't do it nearly as good. I mean, if I was the one stuck running, it'd be awful. There's no question. And he's the one that I delegate and I trust, and he has integrity. And he couldn't do that job without that. So we need leaders of all stripes, of all kinds, really throughout the organization. And we talk about physician leadership at the Cleveland Clinic, but don't mistake that for the fact that we don't have a tremendous diversity of different leaders really throughout the organization, and they're crucial to have. Thanks for your question.
Thank you. Let's go back here and then I'll do a couple online.
Mm-hmm.
Hey, Dr. Malone, thanks for sharing your insights today. Oftentimes when it comes to leadership, I hear leaders say it's very important to be your own best critic. I was just wondering, in a prestigious position like yours, what are some of the practical ways where you're able to be your own best critic?
That's a great question. I'm married. I will never get too full of myself, I promise you, because my wife will take me down. No, seriously, it's a great question. And I think one of the things, if you stop looking inward and stop reflecting onto the job that you're doing and how you're doing it, that's how you lose your team. You know, that reflection, that, yeah, and you need a couple of people that you can go to. You know, I have a couple of leaders at the clinic that I've known for years and years and years, a couple that even report to me, who I know will be honest, who I know will reflect back appropriately to me. And it's hard. I can't, you know, I'm not going to go to any old person and say, what do you think of the job I'm doing? You know, they're not going to tell me. But you have to have that. You have to have those people that you trust. And again, I think you have to think every day, look at the big picture, look at what you're doing, what you're accomplishing, and try to, how can I get better? How can I engage people more? What's not working? You know, I mean, forget what's working. That's great. It's what's not working. And I think if you stop questioning yourself, that's when you get yourself into trouble. And I think that's where the Bill Gates quote comes in. Success is a lousy teacher. You have to just assume that you have to look at different things and change.
So speaking of your wife, that's a nice segue into one of our questions from Dr. Dwayne Taylor, who's one of your classmates. How did you balance your life outside of your professional role and self-care on your way up the ladder?
Not always real well. You know, it's really important. I mean, I'm very fortunate. I have three grown children that are on their own and independent and doing well. And I've been married now for 34 years. So I've been very lucky. But you do have to do that. You have to disconnect. I have, over more recent years, didn't always have cell phones at home that you can answer your email in bed. But over more recent years, by 8:30 at night or 9 o'clock, I turn everything off. Obviously, my phone's on in case there's an emergency. I have to be that way. But that being said, I think you have to disconnect. I like to play a little golf. So when I get out on the golf course, I turn the phone off. Or if I have to have it on, it's on. And you have to disconnect. The one thing I've gotten into most recently is yoga. Actually, I find that that's a half hour where I really can shut it off. And that's important because if you're always on and you see that, people burn out, they really burn out. And you have to be very careful that doesn't happen. It's easy to do. I mean, it's never ending, right? I mean, there's always something that you can pay attention to. There's always something that you can do. There's always an email to answer. There's always another presentation to put together. But you have to take care of yourself and you have to take care of your family.
Right. And I think with yoga, it's so hard because you're on the mat and your mind is just going a mile. Well, mine actually is a mile a minute and saying, just focus on what you're doing. And yeah,
my mind naturally goes to a state of not thinking. It's one of my best qualities is not thinking.
I'm sure for all of us too, with COVID and staying at home and working from home or taking classes from home, it's just so much harder to disconnect and turn that phone off and not answer that email. And
no, I think that's true. I went in every day through the entire pandemic. I went in the office every day. Even if I did virtual visits with patients, I did it from the office. For me, it was important to have work and home. And they're, you know, I do it differently. Some people leave at 5 o'clock and then they get back on and they do things at home. If I have to leave at 7:30 or 8, that's when I leave. But when I go home, I'm done. And for me, that works. There's work and there's home. For others, that doesn't work as well. But that's just the way I found.
And do you communicate that with your staff or those that are under you, you know, those that work with you that, you know, after 7 or 8, unless it's an absolute emergency, you don't expect an answer back?
Yeah, they know. And I think they know because I don't expect them to answer my phone call at 7 at night. I think that that's real important. And I say when they're away, they're away. Mm-hmm. You know, I don't have quite that luxury. So when I'm away, my phone's still on. It's just part of the job. But, you know, for them, I think when they're away, they're away. And I make sure to emphasize that. It's important.
Okay, another question. As a psychiatrist, do you think the integration of mental and primary care is absolutely necessary? And if so, why?
Oh, absolutely. I mean, we know that 35–40% of primary care visits have predominantly a behavioral health component to them. We know that 3 of the top 10 most prescribed medications in the United States are behavioral health medications, or psychiatric medications. We know that the social determinants of health play a more significant role into how healthy you are than anything else. So if we don't integrate those things, we're going to fail. We've tried for years to just treat the symptom. But I've learned a long time ago, I can give the exact right medication to the exact right patient. They can go home and they can't afford to fill it. They don't take it and they come back. And it's, or they try to decide between the medical care and food, or all of those things. And if we don't pay attention to them, it's not going to work. Patients don't get better. We can see that. I mean, people are getting less healthy in our country. I mean, if you look at infant mortality in the United States, of all the developed countries, we're number 17. The wealthiest country in the world. We're number 17. That's not okay. And I think that just saying we're going to get you an appointment isn't going to be enough. It really has to be more than that. Just has to be.
I've got a question up here.
Thanks for your talk, Dr. Malone. Healthcare is filled with perfectionists, and even leaders fail sometimes. Can you talk about the importance of being able to fail with a safety net, or fail fast, or whatever lessons you've learned from failure?
Yeah, no, I think that's a great point. I failed a lot. A lot of my ideas never came to fruition. Often, fortunately, they didn't come to fruition. But you have to have leaders that are okay with that. You have to have leaders that say, try it. Let's see how it goes. I mean, there's parameters around that, but I think it's important. As we grew behavioral health throughout Northeast Ohio and basically quintupled our size, I made some mistakes. I mean, we went to locations where we shouldn't probably have gone. We spent too much for a lease in this location, and it was failing miserably. No patients were coming. Other locations succeeded. And you have to be willing to cut your losses too, and to adapt and change. And I think that's good leaders are okay with failure. And I don't like to call it failure. I just call it maybe misjudgment. But I think good leaders are okay with that. And it gets you a better result. If this is where you want to go and this is the road to get there, it's not going to be like this ever. It can't be. It's got to be like this. And so the faster you recognize this, the off-ramps, the better off you are and the better you're able to get there. And I think that really good leaders understand that and accept it, and they're okay with it. And most important, they don't have the folks that they lead hide their failures. Because if you're a certain type of leader and you know you're going to get all, if they know you're going to get all over them for this, they're going to kind of cover it up and hide it. And that's the worst thing that can happen, because you want to learn from it and you want to adapt and grow. But good question.
We'll go to this one and then I'll do some more online.
Yes, thank you so much for being here, Dr. Malone. My name is Teresa. I'm a second-year medical student. It is really important to be resilient, and unfortunately, fear can be a very powerful motivator, especially fear of failure among medical students. And they can often feel intimidated in clinical settings because maybe their resident physician isn't as welcoming to their ideas, or the attending may be unavailable to speak to, or some other reason. So I guess my question for you is, how would you encourage medical students to promote a culture that values speaking up on rotations, even after receiving potential negative feedback in the past?
Yeah, you mean some attendings are difficult on rounds? Never. I remember a few, that's for sure. And you can't let it deter you. There's different personalities. And when I say you learn things from leaders or learn things from others, one of the most important lessons is to take away what you won't do, what you're going to do differently when you get in that position. It doesn't help you in the moment, but it will help the field. And I think this is going to be very different 10 years from now. It's very different now than it was 30 years ago, I can promise you that. But it's going to get more, it's going to get better and better as we go along, because as we focus on safety, as we focus on patient outcomes in a very different way than we ever did, there's real metrics and data out there now. The only way you get there is having that whole team. Because who knows the patient better than a med student, right? I mean, you know how many hairs are on their head. You know, the attending probably doesn't always know what they look like. I mean, more so now than, again, 30 years ago, but you know that patient. And you probably have more important input than almost anybody on that team. And so I think that folks are recognizing that more. Teams, attendings are recognizing that more. Systems are recognizing it. We don't tolerate behavior that was tolerated years ago. We don't. It's not okay. And it's not just not okay because it's insulting and it's demeaning and demoralizing. It's not okay because it has negative repercussions on the patient as well. So there's a lot of reasons that it's not okay. And I think it's, you know, that speaking up, hopefully that pushback is going to continue to lessen. Don't stop. Don't stop doing it. It's okay. It really is. I know it's not always easy. It's hard. I get it, but it's important. And I think, you know, we now back you up better than I think ever happened before. I do think there is that element. It's not perfect. You know, we have different personalities, to say the least. But I think it's a lot better. And when you guys are the attendings, it's going to be even more different, and it's going to be better. And so it's getting there. It's not there yet, and I know that. But don't stop speaking up.
Piggybacking on that, I'm going to do one online, and then Dr. Langella, I see, has a question. Terry says, agree that encouraging dissent is very difficult for anyone who is not the CEO/professor. How would it be best for students or staff to give input in a consensual, prioritized way? Do you think it would be good to have anonymous surveys of student/hospital staff of the top 3 best and top 3 needs improved ideas? Why or why not?
Yeah, I mean, we do surveys all the time. We do caregiver engagement surveys. We do certainly, one of the most important things we do for leaders is what we call 360s. And so we will choose people they report to, people that report to them, assistants that work with them, and get a lot of feedback and call it a 360 evaluation. And you'd be surprised at how people receive that feedback.
Are they anonymous or are they tied to?
They are anonymous.
Okay.
And some of the, I had my first one probably 15 years ago. It was very helpful. It was really very helpful. And people don't always take it the right way. And if they don't, then they're probably not going to be a good leader. But I think that feedback is crucial. So there's that anonymous feedback that's important. But there's also the direct feedback that's important as well. You know, saying, when we had that meeting, it was really difficult for me. I wanted to speak to this, but I didn't feel like I could. And that's hard to do. It's really hard to do, especially to somebody who's you report to. It's not easy. But I'll tell you, when people have done that with me in the past, that's been the most impactful thing I've ever had. And I'll say, you know, you're right. And if you can take that and learn from it, that's the most important thing of being a leader is to learn and adapt. Nobody's perfect, far from it. That's for sure. But I think you iterate as you go and you grow. And so both of those are good.
Dr. Langell, do you have a question?
I do. Thank you. Don, you and I had an opportunity to talk about the importance of clinician leaders in transforming healthcare because we really understand the patient state. You described yourself as an accidental leader, and I would argue that most clinician leaders are accidental leaders. Mm-hmm. Part of that is because of our educational pathway and the accreditation requirements we have along the way. I think it's more important to be intentional about this for the future. We're growing programs to do just that. And I believe the Cleveland Clinic has stepped up the Leadership Institute to do that within. Can you talk a little bit about how that's been structured and the impact that it's had in this area?
Sure. So we have what's called the Global Leadership Institute at the Cleveland Clinic, which is designed to do a lot of education about leadership for people, not just physicians, but for a number of others. But when you look at physicians, all of our leaders at the Cleveland Clinic on a yearly basis do talent reviews. Look at the people on their teams, people in their departments. I would do my hospital presidents and do talent reviews of each of those individuals and individualize what they need going forward to develop. Some might need help with emotional intelligence, more than a few. Some might need help with finance and the basics of finance. Some may need help in other areas of leadership. And we have targeted interventions, whether it be classes, or maybe you need an MBA, or maybe you need whatever it happens to be. We can target to each of those individuals. So on a yearly basis, we do talent reviews and succession planning, where we look for folks, and it's important that we don't look one level below, but three. And the question about females in leadership, you have to intentionally look at young, developing leaders and do it then. You don't wait till you get here to develop the rest of the way. It's important that you intentionally do it in the beginning of their careers. And I think we're doing a better and better job every year of that, but it has to be intentional. And you have to have the resources. You can't say, you need this, and then how do I get it? You have to have it available for them, and we're doing a better job with that.
Let me see if I can squeeze one more from online, and then we'll go to one in the audience. Holly says, looking back through the pandemic crisis and looking forward, what lessons have we learned about preparing to lead during crisis? What was successful? And how can leadership best prepare for future crises in healthcare?
You know, I think we did really well initially. Physicians are good at emergencies. Mm-hmm. That's kind of what we train to do. So we put 1,000 cots in our medical school up at Cleveland Clinic in case we needed to put patients in them in the beginning of the pandemic. And we built that thing literally in 3 weeks. We're good at that. What we've learned is that's not what the pandemic left us with. The pandemic has left us with a significantly reduced workforce, tremendous burnout amongst our clinical workers, especially our nurses. They're tired. You know, it's a hard job. And now with fewer workers, it's a harder job because they're doing more to make up for the fact that we're short. So we have to figure this out. And we haven't yet. I think that, you know, that is, the crisis is here now. Not that it wasn't a crisis over the last 2 years, it was. But the urgent piece of it, the initial piece, when there's a surge, we get the team together, we get into action, and we get it going, and we're okay. It's when you begin to take a deep breath that the surge is gone and recognize that the fire's still there. That's the problem. And that's really the struggle right now. And I worry a lot about workforce going forward.
I think we can really quickly do this last question right here.
Okay, the average age of a practicing physician is approaching retirement age right now, and that's going to put more pressure on the up and coming leaders. How can you distinguish, though, between ordinary stress of practice and burnout, and any comments on doing that?
Well, I think only the individual can help distinguish that. Some people thrive on being busy and just going from one thing to the next, and others don't, and most don't. You know, and I think that it's really crucial that we pay attention because you're right. You know, over half the psychiatrists in the country are over 55. Well, that's not a great sign. I mean, we need more now, let alone when that happens. And so how do we keep that going? And it really is difficult, but we have to pay attention to the individual. We have to try to address the burnout. Physicians are always going to work hard. That's what we do. It's not allowing that hard work to impact your ability to live an enjoyable life, a fruitful life, and to have a career. And I hear more and more physicians, I hate my job. That's devastating to me, because when that's happening, we're in trouble. So it is something we absolutely have to pay attention to going forward.
Well, thank you so much, Dr. Malone, and thanks for the questions here. We had a lot of questions that we couldn't get to, but I'm going to bring Dr. Langell back up.
Thank you, Betty.
Oh, of course.
Thank you, Don. That was amazing.
Thanks.
Well, I'd like all of you to please join me in thanking Betty Lynn for her expert moderation and Dr. Malone for that incredible and insightful talk. And I need to apologize. It's Betty Lynn Fisher, not Betty Lynn. For those of you in the audience who are faculty members or medical students or pharmacy students or graduate students in other areas here, you should really look at what's on this stage. This is a preeminent leader in healthcare. Dr. Malone is one of 3 leaders under the CEO who, 2 of those are women. But 2 of those are Northeast Ohio Medical University graduates who are leading the way. And so you should really look at what he is doing and what he's done and follow that example. For our faculty in the room, this is a product of the work that you do every single day. Dr. Malone shared with me once that he didn't think he would be where he's at, 1, if it weren't for NEOMED, but 2, if it weren't for Dr. Watana Kunikorn. He said he let me be first author in this prestigious journal. And that is probably, although I'm sure there's a lot more to it, probably one of the big reasons he got into Mass General and really launched his career. So this is an incredible person who's doing wonderful things. And this is what you can do coming out of this institution. Many of his direct reports have told me they call him the president of the presidents. So learn from this, look at the opportunities and think of the great things that you can do in the future. I ask you to please join us next time when Rita Horwitz, the president and CEO of Better Health Partners, will be the VITALS speaker. Until then, please stay engaged, stay active, go back and look at this presentation and unpack the pearls that were in those slides, and stay healthy and well. Thank you.
Health outcomes. Changes due to interventions. To bring positive change, patient experiences and health must both improve. Healthcare costs must be lowered, and clinician and staff burnout has to end. But our problems are big. 133 million Americans have at least one chronic disease. 500,000 people are dying every year from hospital errors, injuries, and infection. The shortage of primary care professionals will be as much as 100,000 in just the next 5 years. Big problems require bigger solutions. Positive change needs acceleration. It needs to happen now. But these are not so easy solutions that many don't want to hear, and even few are willing to talk about. How to lead such a change? How to discover, discuss, and disrupt healthcare to make a difference now? This is VITALS, Visionary Health Leadership in Action.